welcome to Health Talks. Before I start the show, I would like to thank our doctors who are coming on our show as a guest to be part of it to spread the awareness worldwide. Thank you, doctors. So, now I would like to invite my special guest and my co host, Dr. M.S. Kanwar. He is Senior Consultant and Advisor, Pulmonary, Critical Care, and COVID team from Apollo Hospital, one of the best hospitals in India. Welcome to the show, Dr. Kanwar.
Thank you, Rashmi.
Thank you, Dr. Kanwar. You have been a great support for everyone. So I would like to thank you on behalf of all of our viewers, I should say worldwide, not especially US and Canada. You have been supporting us all the time and you're a very strong pillar of MyDream TV USA now. You have been always supporting us. Thank you so much. And a big salute to you again. Thank you.
You're welcome, Rashmi.
एंड
Thank you.
डॉक्टर कंवर आज तो मैं आपकी सबसे पहले टेक्स्ट बुक के बारे में जानना चाहूँगी कोविड के बारे में व्हाट यू आर राइटिंग आई वुड लाइक टू नो अबाउट दैट आल्सो
Rashmi, it started as an idea just about a month ago.
हम्म
And there was a time when we thought, we are just trying to catch up with what COVID is doing to us.
या
And it was like new things happening on daily basis. And we were, all putting our heads together. And we have a very strong COVID team of something like 23 consultants now. And we would sit together, jot down the points, and go through the latest literature, discuss the studies, and see whether we can apply them in our setting, or were we convinced with the outcome of those studies. So we were always into discussions. But then we reached a point where we thought that we have the experience, we have the entire basic knowledge of what has happened with us in 6 months or 4 5 months by that time, 6 months. And we thought that we could probably put our experience into, in the form of a book so that other doctors, other physicians globally, not only in India, could take a sense out of it and see if they could also apply those experiences in their practice. And we were very careful in analyzing those studies which we were coming across. We were very careful in analyzing those studies because there was a lot of conflicting data coming, and it was not easy to cope with that, and plethora of data. So just last month we decided that we are going to do it, and soon we were on the job, and it sort of took an express turn. We wanted to finish the book as soon as possible because otherwise, if the pandemic is over, or if the peak of the pandemic is over in most parts of the world, then we thought that probably the value of the book or value of the knowledge that we want to share with others would probably go down. So that is how we started, and we, I was able to gather 60 authors who are helping me out in this venture, and they're all working extremely hard. And you will be introduced to two of the authors today. And we had challenges. We are continuing to have challenges, but we feel that in another 3 to 4 weeks' time, the book should be launched, and we are looking forward to that.
Of course, we are also looking forward for that, Dr. Kanwar, and good job. And so let's invite our guest for today's show.
All right. Today we have two very eloquent speakers and experts in their own fields. And I would like to introduce you to Dr. Kalpana Nagpal and Dr. Nimmi Rastogi. Dr. Nimmi Rastogi is a coordinator health dialogue and Development Commission in the government of Delhi, and she's also director. She's also director and chief at the OB-GYN at the Sarthak Medical Center in Delhi, and she's a member of the Delhi's COVID task force. So she's one of the think tank. And Dr. Kalpana Nagpal is my colleague in Apollo Hospital for a long time. And she's senior consultant in head and neck surgery and a leading robotic surgeon in India in ENT. In fact, I like to ask her, she probably has done more cases than robotic cases than anybody else in the country.
Wow.
So welcome to you both, Dr. Kalpana and Dr. Nimmi.
Thank you.
So good to have you here.
Welcome
And
to the show. Dr. Kalpana, can you on your camera, please? We cannot see you. She's there. Welcome to the show, Dr. Nimmi, Dr. Kalpana.
Thank you so much. Thank you so much,
Thank
Rashmi.
you.
It's an absolute honor and pleasure to be on your show from this far. I bring greetings from New Delhi, from India. And it's a great marvel that I'm able to connect with the audiences as far as USA, sitting here in the confines of my home and sharing ideas and answering all the questions. It's absolutely my privilege.
Thank you so much. Thanks a ton. Thank you is a very small thing for our doctors. Thank you so much, Dr. Kalpana, for joining us too.
Thank you, Rashmi. Thank you, Dr. Kanwar. It's a pleasure to be here. It's a lovely platform to share your ideas and thoughts and great educative awareness for all the public in North America and elsewhere. It's a great initiative. Congratulations to all.
Thank you so much.
Let me start with Dr. Nimmi then. Dr. Nimmi, we have a huge influx of cases worldwide, 23 million cases worldwide suffering from COVID, and out of which 0.8 million have already died, and the number is still going up. Among them, 3.2 million have suffered in India so far, and almost 60,000 people in India have died.
Yeah.
Rashmi, the numbers in the US are now coming down, as are they're coming down in Russia also. So the numbers in your part of the world are now coming down rapidly, actually.
Yes.
So that's a good news for you.
Yeah.
That's a good news for you, and good news for President Trump also.
Of course.
Because and if the vaccine comes about in quick time, then he'll be the happiest person if he could vaccinate every American before the elections. Let's hope that he is able to do that. Okay, Dr. Rashmi, what is your take now that the numbers are still rising worldwide and in India? So what is your take on that? What do you think is the direction that Corona is taking? Rashmi, there has been a lot of disturbance. Can we do something about that?
No, I
There's a
think
lot
so
of
it's
disturbance,
fine
audio
from our end.
disturbance.
And there's
Oh, it
no
is fine.
technical
Okay.
issue. Yeah, it's fine. Yeah, we are absolutely good. Yeah.
Okay.
So yeah, this
Okay.
question
On my end.
this question you have asked for is for Dr. Nimmi or
Dr. Nimmi.
Nimmi?
Yeah.
Dr. Nimmi.
So, as you rightly said, that 23 million people are afflicted with this, and 8 lakh people have already lost their lives, unfortunately. And this part of the world that we are sitting, there are, say, about 3.2 million, that's 3.32 lakh people, and 59,000 people, that is in India, have lost lives. And if I talk about a small state of Delhi, here 1,62,000 people are afflicted, and we've lost about 4,300. So it's a massive challenge. It's a global challenge. But in India, the cases are coming in phases, like the metropolitan cities like Delhi, Mumbai, even Pune, Chennai, Bangalore, where the flights came with overseas passengers. They bore the brunt of it earlier than the places like Bihar and Uttar Pradesh, where the disease migrated later on. So we are seeing a downward trend in these cities. They have seen the worst. They have seen, the maximum number of cases, and with great efforts now the curve is turning down. So we are seeing some hope somewhere that soon we'll completely kind of take hold of this, and the calamity, the crisis will diffuse. But all over India, the crisis is still brewing, and we are getting as many as about 60 to 65 to 70,000 cases a day, which is a huge number. So we are nowhere near the end in sight, and all our efforts are on to reduce mortality, because we understand this is an infective disease with pathogens passing from human to human. But our whole emphasis is on prevention. Of course, it is there on prevention. It's also on the management and to prevent mortality. We want to save lives. So we are doing everything. Even if a person is affected, we are trying to save lives with early intervention, with home isolation, with kind of monitoring the patients so that they don't turn too serious. And we are trying to provide them with ICU facilities, with ventilators. And our doctors have cracked the code as to what should be done at what stage so that a life can be saved. So, as a medic, and in the company of medics, that is the the focal area of all the medical health professional force. And also the government is since we are too many people, like in Delhi, 22 to 26 million people, unofficially they say that Delhi is 2 crore 60 lakhs. So what do you do? People live in congested areas. People do interact with each other. Some people don't follow social distancing, although the discipline is setting in. But still, the number of infections will be there. We cannot turn our eyes towards saying that we can claim that there will be no infection. That's not possible. But our approach
Yeah,
is more towards containing the disease and preventing the deaths out of it.
Yeah,
yeah,
Dr.
yeah.
Nimmi, people have
And
started
containing,
asking, like, what Delhi government helping people at this time.
um,
Dr. Nimmi,
Yes.
they want to
actually,
know from you.
Yes, yes, Delhi government is doing a very good job. Actually, if you compare statistics of various cities and states, so there was a time on 8th June 2020 when people were predicting the worst nightmare for Delhi, saying that you will have 5.5 lakh cases and you will need 80,000 ICU beds. Whereas Delhi, all in its capacity, had only 14 to 15,000 beds
Yeah,
at that time. So we were kind of completely taken aback, and we were shocked in how do we prepare for a crisis of this scale. But with all possible efforts regarding prevention, management, and all the other things like containment, we have been able to turn the tide in our favor. The curve has flattened. The number of cases are much less, and you will be surprised to know two-thirds of the beds that we prepared for such a eventuality are now lying vacant. That means we are not getting that many patients. Most people are recuperating at home, and our fresh cases are not that many.
great,
yeah,
great.
and our
Thank you.
experience, Nimiji, our experience is that uh, uh, in the hospitals now, more cases are coming from other states, especially UP and
Actually.
quite a few from Punjab also, but
Yeah, so Delhi
particularly
shares
so
its
from
border
UP.
with many states, and with good health facility, sometimes it is to apply that other states come and we cannot say no. It's a human life after all. And if our beds come to anybody's rescue, fine, we are happy. Our doctors are happy to help other states' people. But that burst of the crisis, I don't think is there in Delhi. We
It's a funny thing that happened. When Delhi had a huge influx of numbers. The other states, the neighboring states, they closed their borders. They didn't want the Delhiites to go to the neighboring states, and it was quite upsetting. But now that the numbers are rising there and the numbers in Delhi have gone down,
Yeah,
I don't think I don't think the Delhi government is thinking of closing their borders down, to save Delhi from those people. Now it's the influx could be the other way around. So it's a
Doc-
very funny situation. We never thought
Dr.
ever
Kanwar,
that there could
there
be.
is
Yeah,
there
yeah,
is a very strange fact that's not known to many people, that Delhi is 2 crore 20 lakhs, but 23 lakh people come to Delhi for work or for some other purpose at least once a week.
Mm-hmm.
So we have say about 1/5 of that population that we claim to have that Delhi has. 23 lakh people come here for work from states like Haryana, Punjab, Rajasthan, etc. So ours is a big, huge melting pot of people from all states. And if opportunity arises, we are happy to help everybody.
Yeah, our hospitals have been open to people from all states. We never thought, we don't differentiate, whether what is the residence of the patient, and in fact, in our priority list also, there is nothing like that, as a priority. Uh,
True. Yes, Dr. Kanwar, continue.
can you hear me?
Yeah, we can hear
Okay.
you
Yes, yes, we
clearly
can.
now.
All right. Okay, Dr. Kalpana, I'm sure you have had difficulty in managing the OPDs in the COVID times. I always see you going around the hospital wearing your head cap and your face mask, always. You're never seen without that. So, how have you been coping with the work in the OPDs in the last several months now?
Um, Please unmute your device, Dr. Kalpana. Thank you.
Am I audible now?
Yes, you're audible.
Yeah, certainly it's a challenge for specialties like ear, nose, throat, and also dental. We're directly looking into the throat, nose. Sometimes we need to do suctioning, meaning removing the discharge and mucus plugs, etc. And most of the patients nowadays come for sore throats. They want to know if it's due to COVID or non-COVID. So majority of patients present in the outpatient is either with cough or sore throat. Sometimes it's difficult to swallowing. Sometimes it's kind of foreign body sensation they present with. And yes, it's a challenge for doctors because we have to be throughout, protecting ourselves. In fact, not only the doctors, all the healthcare workers, whoever are working in the ENT department, especially. So we are wearing full sleeve gowns and cap with hood and also goggles and face shields. Face shields, yes, fully covered and all the time, as Dr. Kanwar said, it's to protect ourselves. Why does one want to take any risk? We're also doing procedures bedside, even in the ICUs when we go, we're wearing these helmets. And, face shields, I think it's proven to be a real protecting all the doctors because in our hospital itself, we have seen the doctors, those are wearing helmets, haven't contracted the infection. There are other symptoms also with which patients have been presenting, like loss of smell, loss of taste. So ENT manifestations as such have been predominant during this pandemic. So the outpatient is certainly a challenge, but what we have been doing is also doing teleconsultations for patients whom we can avoid OPD visits because it's, even for referrals, even if physician says, fever with sore throat, we do not want to directly look into the throat unless it's really required. First line treatment, we start off with whatever, conservative treatment feel like antibiotics or anti-allergics, depending upon the case scenario. It may be a simple laryngopharyngeal reflex, meaning acidity, where the patients have been suffering from a long time and the acid is throat and causing some irritation. So our idea has been providing them help over the telephone or either it could be WhatsApp video calls or we could be logging onto the apps. Apollo Hospital has Apollo 247 and also Ask Apollo websites. So patients do register on this and then they speak to the specialists. And so teleconsults have been happening on a day-to-day basis. And for those whom we need to actually see in the outpatient, like, if there's a patient with hoarseness or there is a patient presenting with ulcer, chronic non-healing ulcer in the mouth, or if there is a mass in the neck, or if there is a lymph node that's presenting and you do not know the cause. Yes, for those kind of reasons, we definitely have to perform clinical examinations before we send them for investigation. So it is certainly a challenge, but we're now kind of getting used to it. In the beginning, it was very difficult wearing these gears. Some of us even develop allergies, rashes over the body while, because of wearing these gears. And we have to cotton, pills like anti-allergics, apart from the HCG with prophylaxis every month. So, yes, and but over the past 1.5 months, it's kind of now probably since we're used to it, we don't find it any more difficult. Although staying beyond 4 or 5 hours in those years is difficult, we need some micro breaks as well.
All right. You're getting used to the new life, you know. I remember in the beginning, people were very scared. You know, the doctors, the consultants were very scared to even come to the OPDs, and the OPDs were empty, both of with the patients as well as doctors also. But I think by and by, they have kind of come to terms with the reality and that COVID is going to persist. So they have to modify their lives and they have to be wearing the protective gear most of the time. So that is what we are seeing now. Dr. Nimmi, you had certain plans as Delhi model in fight against Corona. Can you explain what is that Delhi model, which you
Yeah.
thought could be exported to other states and other places?
Yes, yes. Before that, I also want to share my experience, just as Kalpana did. The practice
Dr.
norms
Kanwar, please
they
fix
have
your screen
completely
time.
changed. They
Yeah.
have completely
Correct.
changed. Matlab, it does not feel normal now as doctors when we are practicing. Number of patients that we see in a day has gone down because we go by the adage that every patient is a carrier of COVID germs unless proved otherwise. So you can imagine the protocol that one has to follow, right from shield and mask and all kinds of cover and PPE, and even while operating, it's such a hard call. It exhausts you. Dealing with one patient is like dealing with four patients. So those norms have. It doesn't feel normal to be like good old times.
Of
Yeah,
course.
Coming back
absolutely.
to coming back to Dr. Kamar's question, Delhi model is compilation of certain steps that Delhi took in the nick of the hour, so that to prevent further damage to our population. So Delhi model is essentially about the recognition of fact that most COVID patients are mild patients. Most of them are self-limiting and they can recuperate at home. And only the serious patients need to be admitted in the hospital and they need ICU, ventilator, or oxygen. So how to segregate? So we have a very clear-cut strategy in which every patient who has influenza-like symptoms is advised to get RT-PCR or the COVID antigen test done. And once that is done, an ICMR ID is generated, and that ID sounds the state system that such a such person with this address is COVID positive. So a team of health workers visits his or her place and identifies whether the patient can be kept at home. Is the patient elderly or has comorbidities or is high risk, or what is his general condition? Can that patient be left at home? If not, they directly admit the patient to the hospital. But our experience says that 8 out of 10 patients can be left at home, but under 24 supervision of a doctor on call. We call it teleconsults by a team of doctors. So we isolate such patients with all the instructions, with all the video and audio, that format. And a health worker calls them twice to find out how they are doing. They are given one pulse oximeter at home to monitor the oxygen level. And if at any point in time it falls by 5 or 6%, they just have to call the ambulance, and ambulance comes and takes them to the hospital. Similarly, if they are having difficulty in breathing or their general condition is deteriorating, we pick them up fast and transfer them on our own responsibility to the hospital. So this way, most of our patients are able to recuperate at home, and after a period of 14 days, we discharge them virtually online, saying that now you're fit to go about your work. But the rest of the patients, we have enough beds for them, enough doctors for them, enough ventilators, enough oxygen beds. So intervention of their serious complications is helping us save those lives. So that is one
Uh,
component of Delhi model.
yeah, okay, Dr. Nemi,
Yes.
there was some issue about the quarantine facilities, and a lot of people didn't want to go to those government quarantine facilities.
Right.
So what was the issue, and what did you how did you circumvent that problem?
Okay. So when COVID started, we were clueless as to how to manage, large population. We didn't have as many COVID facilities, but we were told, going by global practice, we were told that such a patient needs to be isolated completely from the neighborhood and from the family. So we were picking them up and putting them in COVID facilities, which were sometimes not up to the mark, and people were scared because nobody wanted to go away from the comfort of their family, and there also they were just resting and having multivitamin tablets. So in that scare, they refused to get the test done if they had influenza-like symptoms, because their experience and visual images on media that people being dragged, and a team of doctors wearing scary PP kids, or sometimes the police comes and picks them up. So there was a lot of panic, lot of scare and panic. So people
Uh,
refused to get the test done. So
and
this led to spread.
Dr.
And
Nemi, yeah, I know
yeah,
I know drastic measures had to be taken, but also there was a word going around, like my drivers would tell me that आज उसको उठा के ले गए, आज वहाँ पे केस था, आज उसको उठा के
जी,
ले गए. The word
yeah,
used was like that, कि उठा के ले
जी,
गए, as if police
जी,
में उठा के लेके jail में डाल दिया. That kind of panic was there. So people obviously were
जी.
very apprehensive, even thinking of the quarantine facility at that time. So,
So, I mean, the psychological trauma was huge. So we
Yeah.
decided we will not pick them up. We will segregate them, separate them in their own homes, provided they have a separate room to themselves. But some people don't have that facility. So to them, we gave the facility of a COVID care center. So that is how we were able to manage huge rush of COVID positive patients, and saw that they improve with time.
yeah, you see,
Yeah.
Another
the
model of
teleconsults. Sorry, go ahead, go ahead.
So that was one part of Delhi model. Another model was this plasma therapy. Delhi started plasma therapy very early. So about in April, we were already doing trials. We were given 200 cases quota, saying that you go, it's an off-label treatment modality. So you try it on 200 patients and see if this works. So when we saw promising results, we took quick actions, and we applied for further permission from ICMR, saying that we can save lives using convalescent plasma. And Delhi was the first state to establish a convalescent plasma bank in the month of July. So we harped on an opportunity very fast, rather than saying that there are inadequate trials or studies. So we used our empirical method of experience-based medicine. And now I think Dr. Kanwar will be in a better position to say whether it's an authentic treatment modality which is able to save lives of critical patients. But in Delhi, it's
Okay,
working pretty well.
we have used in what number is that? Probably quite a large number anyway. I can't give you the exact figure. And initially, we were little. Our impression was that it is doing good, but we couldn't say that on a regular basis because our patients, not all of them, they improved. Some of them continue to deteriorate, and we were using other therapies also, antibody therapy, IL-6 antagonists like tocilizumab. Despite
Right.
giving them everything, including these drugs and plasma, they were deteriorating, some of them. So it was difficult, and in a lot of cases we gave the two together. So if the patient improved, we didn't even know whether a plasma helped or tocilizumab helped or steroids were helping, which we were of course giving in a standard dose, the dose that we have decided in these cases. So we were doing that. Now the jury is still out regarding the efficacy of plasma worldwide. We are still waiting for the ICMR trial results. We were a part of that trial, and the results are awaited. So, the unofficial view has been that the results are iffy. It's not a conclusive report in favor of plasma. So, but at the same time, when we were clueless, when the disease was rampant, people were dying, and we were having a rush of cases in the ICU, anything that had given a glimmer of hope should have been tried and was tried. And I think that was the right step. If that was not
Yeah.
done, and today, if plasma had proved to be a very effective therapy, then we would have felt sorry why we didn't give the benefit to hundreds of patients earlier on. So that was the right thing to
Yeah.
do. And the way you went about with plasma banks and stuff, that was wonderful. I think Delhi did take some very quick decisions, wonderful steps, and calamity was looming very large. And the way you said, there was a hospital created with 2,000 beds, which never got filled more than 200 odd. The bed occupancy was just that much. But it is better to be prepared than be sorry. So if the railway compartments were getting ready for an
Yeah.
Yeah.
eventuality where the thing could have blown up like a Spanish flu, then
Yeah.
that was the right thing to do, even though they were never used. Um,
Yeah. So
Perfect.
there was
So
a
I think
time when Delhi thought that they were over prepared. Isn't it? As in, there is a 20,000 bedded facility that's been prepared, and the number of patients admitted there are only 400 to 500. So our detractors told us that you just overspending. There's no need. But we wanted to be over prepared rather than under prepared because the
Yeah.
scare was so much, and it never hurts to have extra facility. You never know, the situation turns worse. And about plasma
and not
therapy,
only
I
that,
understand it's not a panacea for all the patients, but globally there are 35% chances of saving a life of a critical patient by infusing convalescent plasma. So I think in my clinical experience, I think it's worth a try.
70,000 people have received plasma in USA alone. 70,000.
Yeah,
So that's a
yeah,
huge number, even though it was only used as emergency use authorization. It is not approved
yeah.
by FDA. Yet 70,000 people have received that in the US. But
Yes.
uh, that is about how the state's preparedness has been. I think we have done an excellent job overall. Dr. Kalpana, um, you know, how many robotic surgeons are there in India at the moment?
If you
In
ask for robotic
ENT?
ENT surgeons, robotic ENT surgeons, not even 10, because the training is not happening in India currently. The Robotic Institute or Training Center for ENT and Head and Neck is yet to, I mean, and still in the planning stage, and then probably it will shape up one day. So far, now the candidates will have to go to Seoul or San Francisco for training. Even Paris is a center, and that is why we have very few trained robotic ENT surgeons. So, as I said, not even hands.
Why don't you start a training center? You are so well
That's a good
equipped.
one.
You should have your trainees with you.
Yeah.
Yes, I've already passed on these suggestions to Da Vinci Robotic, Center in San Francisco, Sunnyvale, and also I've spoken to other people like Chairman, Par Hospital, and we're still looking into it because when the planning and everything happened, ultimately the COVID thing started off, and so it's now kind of not taken up. But in a couple of months, I think we should be able to start a center. I've also been speaking to some other people who can be partners for this, and it will be a great venture because there will be a lot of candidates. And since this is the future, robotic surgery. We need a lot of juniors and colleagues to get trained for this, and I hope it will happen ultimately. So since I'm already a mentor also, like I received this mentorship from Sunnyvale, and now I'm a licensed doctor who can train others, and so I've already been training a couple of people. There are already observers coming from other countries like Africa, Russia, Afghanistan, Nepal, etc. So if we have a formal institute, it would be much easier. But currently, I'm mentoring few people who have to be, observing some of my surgeries and then do it. Initially, we also have to plan to have a cadaveric lab. So all this is kind of a challenge to take up. But once we have the resources in place, it will not be delayed. Hopefully, in 2021, we'll have it.
Dr. Kalpana, how are you managing in COVID times? How are you managing the surgeries and robotic surgeries? I mean, you must be taking extra precautions. Of course, you are wearing the PPEs there, but do you have any difficulties with the fogging and the breathing difficulties that we have if you are in the PPE for too long?
Yes. Now, there's a difference. I want you all to understand that robotic surgery is much safer during this pandemic. Why? Because the surgeon and the patient are staying few feet away. Like I'm not touching the patient or directly the tissues. And similarly, the patient is away from the doctor in case the doctor is a carrier. So I want to tell the patient that robotic surgery is much safer than traditional surgery for COVID pandemic. And well, by doing traditional surgeries and endoscopic surgery, it has been challenging, even for procedures like emergency tracheostomy, etc., where we make a small breathing passage in the neck. Yes, the shield can get fogged, and so you put stickers on our nose, and so that there is no air leakage, and which is going to be tough. I mean, but we're all managing. I mean, fogging is certainly a challenge. Apart from other challenges, even our voice is masked. Even communication becomes difficult. So speech and hearing, everything is kind of not the same as in normal
Yeah,
circumstances.
yeah, absolutely. Robotics is a different thing that you are not too close to the patient. But how about tracheostomy? When you
Also, when I'm
create a
sitting in
hole
front
here,
of the
let me just explain. Tracheostomy is when you create a hole here so that the
yes,
patient breathes through that hole
Okay.
instead of
yes,
the tube through that, yeah, through the mouth.
Mm-hmm.
When the patient is on ventilator,
Yeah.
or even when the patient is not ventilator, he needs a breathing tube here. Then then when you do this, you have to use the suction also. When you use the suction, you generate aerosols. Aerosols means if the patient is infected, that he can generate aerosols which can go meters away, so can infect the healthcare workers, the doctor, the nurses, and the other staff who is around. So, what do you do in case of tracheostomies, Dr. Kalpana?
yeah. As you just mentioned, tracheostomy is one of the highest risk procedures because it generates a lot of aerosols. And there are other ENT procedures also like endoscopic nose surgery and also throat surgeries which generate a lot of aerosols. We do take special precautions for doing tracheostomy. We're wearing full PPEs. And of course, for every case before admission, we get a RT-PCR done. And if it's COVID negative, then of course, we take them to the non-COVID theater. If it is COVID positive, if it's an elective case, we delay it. And if it's an emergency tracheostomy, or otherwise also, even in non-COVID tracheostomies, we consider them as COVID cases and take full precautions. So the entire team takes precautions, which means full PPE.
Yeah,
Absolutely.
I must make it a point here, Kalpana, that in our hospital we are taking from day one adequate precautions to segregate the COVID and the non-COVID areas. Our management, our director, medical services, and our managing director, they have been very keen to set these things right because this only creates a paranoia among the staff if there is a mixing of the COVID and non-COVID patients, and also a paranoia with the attendance of patients or the non-COVID patients who might be visiting the hospital. So in Apollo Hospital, we have made very adequate arrangements where the two areas are segregated. So, any comment of yours on that?
Like we have a separate COVID theater, which is completely at the opposite end, and the patients are transferred with through a separate path, and therefore there is no crossing over like normal patients or public doesn't cross over. And this segregation has been planned by Infection Control Committee, and it has been excellent. And that is why we keep telling our patients that our area is totally different, and a non-COVID area is segregated from the COVID area. and even the fumigation protocols and shutting down the theater after every case. And we've been following every strict measure as advised by the Infection Control Committee. And that is why we are having excellent outcomes and no infection post surgery.
Yeah, excellent. You raised this, this point. And Rashmi, just to tell you that in our hospital, the healthcare workers haven't been infected to the extent that they have been infected worldwide, even in
Wow.
the Western countries with
That's
excellent
correct.
healthcare facilities. In our hospital, we pride in the fact that the number of healthcare workers down with infections were, you know, a, a, just a minuscule number as compared to what we have been hearing elsewhere. Even Harvard, the
Wow.
figures there were 22%. Our figures
Yeah.
was something like less than 6% or so. Despite the fact that we go into the COVID areas, when we are on duty, we are in there for several hours at a stretch, and our nurses, our doctors, they are there for at least 6 hours duties. And I tell you, I mean, even yesterday I did the rounds. It's hats off to them. They're doing a wonderful job. In those situations, it is hot. You keep sweating all the time. You keep sweating all the time. You can feel the drip of the sweat going down your body. And there is a little fogginess. You can't see very clearly. And you also feel a little difficulty in breathing. If you try to walk fast, you feel breathless very easily. So all these problems have been there. Yet our teams have had had their spirits high. And Kalpana, you have been pioneer in also doing, sort of kind of encouraging the healthcare workers with your own way of keeping their spirits up. So what do you do for that? I mean,
Yeah,
you have
do
been
share with
Yes,
us.
active
certainly.
on WhatsApp program, and you have been giving ideas. In fact, one of the chapters that you've written, Rashmi, both the ladies here, Dr. Nimmi as well as Dr. Kalpana, have written chapters in the book, and they have
Wow.
already been accepted by the publisher. So you will see them in the form of a book as well as dynamic ebook after, I believe, exactly 1 month from now.
Awesome.
Uh,
We're so
so,
proud of you, Dr.
Kalpana,
Nimmi
what do
and
you
Dr. Kalpana. Amazing.
As Dr.
so
Nimmi just
what do
said,
you what do you suggest there?
yeah,
What do
there's a
you keep
lot of
proposing to
psychological
everybody?
there's a lot of psychological trauma even amongst healthcare workers. After all, there's a lot of financial instability. There is, hardly any communication happening between colleagues. You're not even seeing them. It can even lead to depression, isolation, and these kind of things, especially in elderly colleagues of ours, people above 60. Most of them are, first they had this fear of coming, and then now they're coming slowly, but yet, having that constant fear in them. So, in order to alleviate this anxiety and fear and depression, isolation, I've kind of made a nice communication group, meaning where we had small quiz like programs where I would ask, like post a picture and say, where does this picture belong to, like the locale, identify the locale, or identify old pictures of some colleague, for fun. Because, if you post a childhood picture or a college picture of a colleague who's more than 50 years old, it's kind of nice and everybody is having some kind of relaxation. Apart from that, people are building up on their hobbies. They're able to revive their hobbies because there's some time now, some extra time that they're getting now because of not doing so many elective surgeries. So people are into music, into dance, into art. There's so many things that we can explore, and this recreation is actually required for doctors because it's a nice stress buster. Even in our
Yeah.
hospital, from the beginning, the management has encouraged us to have, separate area for playing carom, and we have magazines in the rack. After all, in between surgeries, you need to, de-stress yourself. So this has been really nice, and then we actually have now come closer because we have even come to know about each other's achievements, about our story, how we have reached till this stage. And generally, we have even known about each one's family. So it's been nice. It's been nice. I've been receiving a lot of messages from colleagues that it's an excellent initiative.
So, Dr.
As
Kalpana,
Kalpana
if the
is saying,
people wants to
it's
know
these are hard
how you
times.
feel, yeah, Dr. Nimmi,
Ji.
you're saying something.
So as Kalpana is rightly saying, these are very hard times for doctors. Being in medical profession is, if there was any hard time, this is now.
Of
Let
course,
me tell
that's
you
what my
that
question is. Like, I have so many questions from our viewers. They really want you to share your experience, Dr.
yeah,
Kalpana. Like, when you are
yeah.
going near to COVID-19 patient, how do you feel? Like, of course, end of the day, we are all humans. So we are not able to deal with anyone. Here, when we talk to someone, so we feel so scared. We don't want to hug anyone. We don't want to be nearby. So when the doctor is having a patient, so they want you to share your experience, like when you go near to them, how you feel, what is your feeling? They want to know about that.
There are alternative means of communication. That's important. We all see, even if you can't hug or you can't shake hands, you can kind of talk to them. The rapport will be built up, and pleasantly say things like, inquire about how their life has changed, and how, if their businesses are okay, or if they have had any problems related to their job. So things like this, initially you can talk to the patient for about 2-3 minutes, and then they develop confidence in you, and then you share. I mean, they are more free, and they could share all their problems with you much more easily. So even while after sharing scans and everything, then you kind of even counsel them and alleviate their anxiety, because most of them now ask on the telephone, or even when they're in front of you, the question is, "Doc, is it okay to postpone our procedure? Is it okay to do it somewhere else?" So we keep telling them, no, see, this COVID pandemic is going to be continuing for a long time. So you have to, there are a lot of non-COVID conditions which you cannot delay. There are conditions which, if you delay, can lead to complications or poor outcomes, like if there is a malignancy in the throat. And if the patient had actually presented in stage 1 couple of months ago, and if you're kind of advised surgery, and told them that the surgery is just sufficient and it will give you best results, and there is no need of chemotherapy or radiotherapy, and if the same patient delay, the stage 1 turns into a different stage. It could be stage 2, stage 3, stage 4. So the outcomes will certainly not be the same. So you have to keep telling these patients. In fact, we have been giving awareness talks to, through various media about not delaying non-COVID cases, which are very important. And of course, those conditions which can stay, can hold on. At the same time, we tell them, if it's not an emergency and if it's not going to change your outcomes, like for example, if there's a crooked bone in the nose, well, that can hold on. So communication is the
That's
best
correct.
way
Yeah,
to
Yeah,
eliminate anxiety.
correct. And for Dr.
yeah,
Nimi, I
and
have a few questions I'll just take. We are not taking calls, but this is what our major question is all about. They want to know, newborns, babies are also affected with COVID-19? Dr. Nimi.
OBGYN practice allows us to kind of, like if there is an impending labor or a delivery, we kind of get RT-PCR test and we come to know that if person is affected or not. But there is so far not the risk of uteroplacental transmission of this virus that we have seen. But it is a matter of study for at least 6 months to see what is the impact on the baby is born. But certain impacts are already known. Pregnancy is a hypercoagulable state, and COVID is also a hypercoagulable state. So we tend to avoid surgeries, especially cesarean. If normal delivery can take place, we prefer that.
Okay.
But so far, effect on babies is not been established.
And that's good to know. And Dr.
Yeah.
Kanwar, our viewers want more limelight on your book, like what you are covering in that.
oh, we are covering almost everything that you can think of about COVID.
Mm-hmm.
The technical things like the history, of course, history, evolution, how the disease happens. It's called pathogenesis. What's the way, and then what it causes in the body. We deal it with in pathophysiology. In fact, we are looking at all the challenging aspects of the disease in various chapters.
Okay.
And for example, the patients who worsen very rapidly, they are apparently doing well at home. By the time they reach the hospital, he's on oxygen. By the time he reaches the ward, he is already on 5-6 liters oxygen, and then within hours sometimes, or by during the night, the patient is on ventilator. So these are the kind of cases we have dealt in separate chapters.
Okay.
So very elaborately. One other thing, which is now well established, is called long COVID, or it is COVID related long-term complications or long-term symptoms which just don't go away.
Yeah.
Weakness, lethargy, fatigue. This is something that people are experiencing even 3-4 months down the line. They don't want to go to work because they think that they're incapable of going to the work. This is what happened during SARS epidemic. And people later on, even up to 18 months after SARS, who were healthy, going around their work, they stopped going to their work. They lost their jobs. So those kind of things happened. And since in the corona family, they both the viruses behave in a similar way in so many ways. So it is predicted that quite a large number of patients could end up with a long COVID syndrome. So we have dealt that as a separate chapter. So, anything that you can think of regarding COVID is covered in the book.
Great. Good to know. Thank you so much for the information, Doctor. Thank you. You can continue with Dr. Nimmi and Dr. Kalpana.
It's been such a
I
pleasure.
just wanted to give one bit of information from
Sure.
from Indian state, and that is that we have also lost quite a number of our doctors and health professionals, but it is nowhere close to international census on calamity on doctors.
Yeah.
By a rough estimate, I think 270 doctors. 278 doctors have lost their lives, which given the fact that there are 60,000 people who unfortunately lost their lives, it's not as much as what we've heard in places like Spain, UK, US.
Of course.
I don't know, by some strange stroke of luck or by our own prophylaxis, our health workers are able to protect themselves better.
I think so. Precautions have to be taken.
I have a little explanation for that. In the earlier days, in those countries which you mentioned, Spain, Italy, France, UK, Germany was well equipped. They had PPEs in place from the beginning, and USA also. If you had seen the images of people going around, the videos, you would have noted that not everywhere were they covering even the neck area. So there were shortage of PPEs because the disease came rampantly, so quickly, so fast that they were not ready with the PPEs. They were not ready to deal with overwhelming catastrophes and the numbers. And they, even without PPEs or partially clad PPEs, or when they were not fully covered, they were dealing with the patients. So that was the time when a lot of them, they caught the infection. But by the time, the lockdown that happened in India was the best thing they did. If that had not been done, we would have had massive numbers in our hospital. We wouldn't have been able to deal with the numbers in terms of the hospital beds, the ventilators, even the personnel. We would have fallen much short. So we were able to get the PPEs in place by the time the patient started becoming ready with that. So I think that was one of the reasons that we were very well prepared, and we had already seen the things going wrong elsewhere. So we could prepare ourselves in a better way. There is no other reason. It's not that
with HCQ help, doctor?
Well, we feel so. I still continue to give that because based on whatever data we have, HCQ helps in preventing the virus entering the cell. So if it is effective, it has to be effective as a prevention or in a very early stage when the virus is just trying to get in. That is the stage when if it has a role, that is the stage. Later on, I don't think it works at all. And the jury is still out on HCQ. This has been a big question mark always, whether it works or doesn't work. But again, just like in plasma, case of plasma, and HCQ had some place in SARS, and patients were given based on that, and the study of the action of the drugs and the pathogenesis, the way the spike protein kind of enter the cell. So that is how they studied in vitro and later on clinical data that some response was seen. In India, the ICM also reported that based on the HCQ prophylaxis they gave to the, for example, police personnel, municipal personnel in Mumbai, there was a study. There was, they felt that those people did not fall sick as frequently as others did. Number two, not too many of them became very sick to go to the ICUs. So there is a plausible explanation to say that either the disease was prevented to some extent, or else it did not become as bad as it could have been. So I think we still have a positive vibe towards HCQ. I haven't ruled it out. Yeah, so we are still using that until a study clearly tells us. And one study may not do the justification to the drug. Even if there is a one RCT, I would still take it with a pinch of salt. I'll still wait for more RCTs to tell me that this drug is absolutely useless, to stop using this in a disease like this. It is so cheap, inexpensive, available everywhere.
Yeah.
Yeah.
Correct.
So, Rashmi, you have any more questions?
No, we have covered mostly everything, and the major questions I've asked, and of course we will start opening our lines also soon, viewers, because we want our doctors to share their information with all of you because it's very informative. And thank you, Dr. Kanwar, thank you, Dr. Nimmi, and thank you, Dr. Kalpana. It was great to have you on our show, and thank you so much for coming forward and sharing information and spreading this knowledge across the globe. Thank you so much. Yes, Dr. Kanwar,
Thank you
and
so
I
much.
would like you to say
Thank you,
something
Dr.
before we
Nemi,
end the show.
Dr.
Robotic.
Kalpana, and thank you, Rashmi.
Absolutely, my pleasure.
Thank you.
Dr. Nimmi, I would like you to say a few lines before we end the show.
So I would want to say that this is a new pathogen and it's such a huge global crisis that I feel that all of us are in a big boat and we are sailing together because this virus does not spare anybody, no age group, no class, no country, no ethnicity. So, I mean, in a way, there is an assurance, okay, it is happening with everybody and soon we will we will get some remedy which will kind of, save us from it.
Yes.
But the global nature of it is something which has taken the world by surprise. And, there are many more complicated, more serious diseases still prevalent, but human nature is such that it feels that only COVID is important because it can kill me in 2 weeks.
Yeah.
So it has changed. It has brought a paradigm shift in the mind of patients as well as doctors. Some justified, some not justified. But our pursuit to find a lasting solution to this pandemic continues till we get to the end of it.
Absolutely right. Looking
As you
forward.
said, Dr. Nemi, uh, people, as you said, in 2 weeks, people can think that they can actually die. Young people also, which they never thought, they never planned life like that. And they come to us with those kind of questions. They're scared. At times they're scared. So half the time my job is to pep them up, just tell them, I see their CT. I look at the CT, I see the changes. I know what he has. And then they have been told by whosoever did the CT that, oh my God, you have this. And the patient is sitting before me, not even on oxygen. And I don't see, even while walking into my room, that he is too breathless or something. And we check saturation is okay. So I have to explain to him that, well, it's your choice. You want to be admitted? Fine. If you don't want to be admitted, this is the course of treatment which I'm going to give you, whether you're in the hospital or you're at home. So sometimes they feel so comfortable and they said, okay, great. If there is something wrong that happens, I mean, I develop any new symptoms suddenly, or my oxygen falls, they use an oximeter. If that falls, then I'll get in touch with you perfectly. And I tell you, vast majority of them do not come to the hospital for admission. They feel safe. But it is, they should have the confidence in you and you should be able to reassure them. But when we feel that this is not the right patient to be at home, we tell them be admitted. If the patient doesn't get admitted, then the risk is his. So we explain that also. But anyway, the point is that majority of the cases they do very well at home and just on some oral treatment at home. Even steroids, we give them when we give them dexamethasone. Since the British trial, we are giving them 6 milligram of dexamethasone, and that is fine. They are handling that. Sometimes anticoagulants. If the patient really doesn't want to get admitted, we give them oral anticoagulants at home. So we manage those situations also. Some people just don't want to get admitted. Yeah. Some people just don't want to get admitted. Even when they have comorbidities, even when somebody is 75 years, 80 years old, they just don't want to come to the hospital. We have treated a lot of them also at home. When the CT is not normal, CT is abnormal, and the oxygen is hovering around 92%, it's not normal. Yet they did very well. So, but, we have to be very careful who
Doctor, in the month of April, I lost a dear friend of mine who used to practice with NHS in UK. That was in month of April, and she'd just gone from Delhi. And that time I realized this beast is not to be taken lightly. That time we didn't have that much of understanding and we lost her. But now similar situation, similar case can be saved, and I can say that with confidence.
That is
You're right. Perfectly right.
So, Dr. Kalpana, before we end the show, few lines from you also.
I would like to tell everyone to spread cheer and positivity while you're taking precautions. Be informed adequately, but do not watch media too much because, don't absorb negative energy from the media. So there's a lot of media hype. Watch health talk shows like this and be helpful towards others. And regarding robotics, it's a very big subject as it is. So the indications, advantages, and how robotics is different from traditional surgery, etc., probably requires a separate session.
We'll talk about that on another day, Dr. Kalpana.
Yeah, it's a very small session, and we have so much of information to be shared from Dr. Nimmi and Dr. Kalpana. So much to know from them. Today we have to open our calls. We had so many calls, but viewers, time is short, so we have to finish our show on time. And Dr. Kanwar, before we end the show, I would like you to say a few lines also.
Well, after they have said everything, there is nothing left. But I just want to say, that people must remain positive. There is always light at the end of the tunnel, and the way the disease has started to fall rapidly in countries like USA, Russia, and it did in Spain, Italy, UK. Germany, France, did in China, South Korea, Japan, even Iran. So let's take that example. And even if the numbers in India are still very high, the new cases in a day are, still very, very worrisome. Yet we know that this is like a fire. This is like a wildfire. Those areas which have been burned, the disease would cool off there, and that is what is happening. Though there are cases of resurgence in Spain, Italy, and also recently, but those numbers are minuscule as compared to what they have gone through. So I think we should stay positive, as Kalpana said, and we should just focus on any symptoms if they are developing. Consult your doctor. Don't just decide on Ayurvedics or other things. Just let's have some scientific data on whatever we are doing, whether we are treating the patient or we are just observing the patient. It should be on scientific grounds.
We got to outsmart the virus and crush it forever.
Of course, we'll be out of this pandemic, I think, so soon because it's really crazy, and I really pray to Almighty God that this should be over as soon as possible because we are looking forward to have the normal life back. Everybody wants that.
I have always been saying on the media channels since February that the future historians will write life before Corona and life after Corona.
Yeah.
And so this is what we are going through. The life has changed altogether.
So thank you, Dr. Kanwar. Thank you, Dr. Nimmi. Thank you, Dr. Kalpana. It was great to have you on our show. Thank you so much. And viewers, maintain your positivity and only be negative only for coronavirus. So thank you all. Have a great day. Thank you.
Thank you.
Bye.
Thank you.
मैं हूँ रश्मि बेदी। हमें उम्मीद है ये शो आपको पसंद आया होगा। लेटेस्ट वीडियो के लिए देखते रहिए माई ड्रीम टीवी यूएसए और पसंद आने पर लाइक, शेयर और सब्सक्राइब करना ना भूलें। थैंक्स फॉर वॉचिंग माई ड्रीम टीवी यूएसए।